Hey guys, welcome to the first episode of Study With Me. Let's learn trigeminal nerve the easy way. Okay, so trigeminal nerve is the fifth cranial nerve. It has 4 nucleus and 3 branches. Remember M2, S2, which are the 4 nucleus: motor, mesencephalic, superior sensory, and spinal. Quick recap: motor, mesencephalic, superior sensory, and spinal. Which are the 3 branches? Remember OMM, ophthalmic, maxillary, mandibular. The first 2 are sensory and mandibular is the mixed nerve. Okay. Ophthalmic nerve is a sensory nerve. It has 3 branches: frontal, lacrimal, and nasociliary. Frontal has 2 other divisions: STSO, supratrochlear, supraorbital. Nasociliary again has 5 more branches: AEPE, anterior ethmoidal, posterior ethmoidal, long ciliary, ciliary ganglion, plus IT, infratrochlear. So, once again, quick recap. Frontal has 2 branches: STSO, supratrochlear, supraorbital. Lacrimal is the next branch. Nasociliary has 5 subdivisions: AEPE, anterior ethmoidal, posterior ethmoidal, long ciliary, ciliary ganglion, and IT, infratrochlear. Next up, we have with us maxillary nerve. It has 4 subdivisions coming from MCF, which is the middle cranial fossa, pterygopalatine ganglion, infraorbital canal, and face. So, from the MCF, we have 1 branch, which is a meningeal branch. From the pterygopalatine ganglion, also known as hay fever or sphenopalatine ganglion, we have 3 subdivisions: ganglionic, zygomatic, and PSA. PSA is posterior superior alveolar. Zygomatic again has 2 subdivisions: zygomatico-temporal and zygomatico-facial. Next up we have infraorbital canal, gives rise to MSA and ASA. MSA is middle superior alveolar, ASA is anterior superior alveolar, and from the face we have 3 branches: palpebral, labial, and nasal. Okay, so quick recap: 4 origins: MCF, pterygopalatine ganglion, infraorbital canal, and face. From the MCF, meningeal branch. From the pterygopalatine ganglion, 3 branches: ganglionic, zygomatic, and PSA. Zygomatic has 2 subdivisions: temporal and facial. Infraorbital, 2 subdivisions: MSA, ASA, and face has 3: palpebral, labial, and nasal. Next up, we have with us mandibular nerve, which is the mixed nerve. 3 origins: trunk, divides into anterior and posterior division. From the trunk, we have 2 branches: meningeal and nerve to medial pterygoid. Nerve to medial pterygoid supplies tensor tympani and tensor villi palatini. The anterior division gives rise to nerves supplying the muscles of mastication. There are 4 muscles of mastication, except for the medial pterygoid, which is arising from the trunk. The other 3 muscles of mastication, lateral pterygoid, masseter, and temporal. The nerves to these come from anterior division, and anterior division also gives rise to the buccal nerve. For the posterior division, remember the term Ali, that is our ATN, lingual and inferior alveolar nerve. ATN is nothing but auriculotemporal, lingual, and inferior alveolar nerve. So once again, quick recap for the mandibular nerve. Trunk, which divides into anterior division, posterior division. From the trunk, we have the meningeal branch and nerve to medial pterygoid. From anterior division, 3 muscles of mastication: temporal, lateral pterygoid, masseter, plus the buccal. And from the posterior, we have Ali, auriculotemporal, lingual, and inferior alveolar nerve. So that is our trigeminal nerve in under 5 minutes. So can you tell me which are the 4 nucleus? Yes, it's M2S2. Can you tell me which are the 3 branches? Yes, it is OMM. Can you tell me which are the branches of ophthalmic nerve? Yes, that's right. It is frontal, lacrimal and nasociliary. Can you tell me which are the 4 origins of maxillary nerve? Yes, it's right. One is meningeal, and from the MCF, one is from the infraorbital canal, one is from pterygopalatine ganglion, and one is on the face. So that's quick recapitulation in under 5 minutes. If you like the video, please make sure you subscribe to the channel.